Chad here with Rogue Wellness Consulting. I'm a certified registered nurse anesthetist and an expert in pharmacology with 10 years of medical training and experience, bringing you real peptide info real quick to give you the knowledge you need to make competent and informed decisions regarding your health and well-being, because self-care is healthcare. Let's talk about retatrutide, also referred to as GLP-3. It's a triple receptor agonist, meaning it enhances the function of three different receptors in the body: glucagon-like receptor 1, GLP-1, glucose-dependent insulinotropic polypeptide, GIP, and glucagon receptors. Why this matters. GLP-1 receptors are found throughout the body, including the gastric mucosa and pancreas. They activate certain cellular pathways that primarily regulate glucose and lipid metabolism. They promote insulin release in the presence of high blood glucose levels while inhibiting glucagon, which typically raises blood sugar levels. This combination helps maintain steady, appropriate blood sugar levels, which is ideal for the overweight and/or diabetic individual, as it leads to reduced cravings, improved cognition and focus, and better sleep, which have long-term benefits on your heart, kidneys, eyes, nervous system, and more. These receptors also delay gastric emptying and reduce appetite. While calories in versus calories out isn't the whole story, because we are not a closed system, managing energy balance plays a huge role in optimizing and maintaining a healthy weight. Something awesome about GLP-1 receptors is they are also found in different areas of the brain that affect mood, stress, pleasure, motivation, hormone release, and sleep-wake cycles, meaning GLP-1 agonists may also have many more benefits other than just weight loss. Number 2, GIP receptors. They are found in fat tissue and nerve cells, but primarily in the pancreas. When these receptors are activated, insulin is released in the presence of high blood sugar levels. However, in the fasted state, GIP agonism increases lipolysis, which is fat breakdown, by metabolizing free fatty acid from fat cells to be utilized as fuel. You can see how GIPs work synergistically with GLP-1 activation to optimize metabolic health. Tirzepatide is an example of this dual agonism. But where TERS stops, Reta steps in. We got the GCG agonism, the glucagon aspect, which is the nail in the coffin in terms of losing stubborn body fat. The 29 amino acid chain stimulates glucagon receptors, increasing energy expenditure by stimulating the liver to release stored glucose and break down triglycerides in fat tissue. Glucagon also stimulates thermogenesis, leading to an increased metabolic rate, which means you're burning more calories without increasing output. You can clearly see why retatrutide is a game changer. The glucagon effects are potentiated in a fasted state, which is made possible by the GLP-1 and the GIP receptor agonism that assist in reducing overall caloric intake. This is why the studies reflect up to a whopping 24%, did you hear me? 24% reduction in body weight in less than a year, with the majority of the weight loss being body fat. So if you have a 200-pound individual in a period of less than a year, they lost 48 pounds, and most of that weight was body fat. Incredible. Doses used range from 2 to 12 milligrams, with GI distress like nausea, vomiting, diarrhea, and constipation being the greatest side effect reflected in a dose-dependent manner. Meaning the higher you go with the dose, the more likely you're going to start to encounter problems. Though these adverse effects were typically mild in nature and mainly occurred after the dose increased to 8 milligrams or more. So it would make sense for anyone researching this polypeptide to start low and go slow to avoid any potential problems. And while we're on the subject of dosing, let me handle a hotly debated topic: microdosing. While it's true Reta was designed to be a once per week administration, and that works well for many. I mean, look, that's what they did in the studies. Others have found that breaking up that dose into 2 or 3 separate administrations reduces the risk of side effects, especially if somebody is starting to creep up into that 8 to 12 milligram range. Plus, you have to keep in mind it also depends on the indication. Why is somebody researching this peptide? As mentioned earlier, the triple G affects many receptors throughout the entire body. that affects many different parts of the body. The researcher utilizing Reta for, say, longevity or immune boosting effects or to improve cognition won't need crazy high doses. Doses of 10 to 100 micrograms, that's zero point 0.1 milligrams, have been reported to show benefit. In the end, the researcher should do what works best for their research and be wary of anyone who is so closed-minded and believes that he is the only one that's ever right. If you want more information on the Triple G not covered here, shoot me a DM on IG or send me an email. Links are in the description down below. Lastly, if you've got Moses goals like me and want to take advantage of all the tools and the biohacks that we have available here in 2026 to make our life full of years and our years full of life, please like this video and subscribe to the channel. It'll go a long way, and I've got a lot more coming your way on peptides. So until that next video, peace, love, and long life I leave with you.